Can you guys introduce mommy?
Spill the beans with Dr. Jill.
Hi, everyone. Thank you so much for joining on today's episode of Spill the Beans with Dr. Jill. As always, I would like my guests to introduce themselves.
Well, hello, Jill. My name is Candice Wade. I'm a school counselor. I work with high school age students, but I have a background with probably over 20 years of experience in the helping profession, working with trauma informed care, as far as like just working with DCF involved families, and as far as clinical counseling.
That's exciting. Candice, what is your educational background?
Oof, okay. So I have my bachelor's degree in psychology. I have my master's degree in human services with a concentration in clinical counseling. I also have two postmaster's certificates, one in school counseling and one in nonprofit management.
It's so impressive. And I know that you have worked for a lot of different organizations in your education or in like your hands-on training with the organizations. Have you ever formally been taught about vicarious trauma?
Absolutely.
Tell us about it. What did you learn?
All right. So this was many moons ago,
Yeah.
right? But I just know to try to break it down in simpler terms, like vicarious trauma is just kind of like how your nervous system responds to like indirect trauma, right? So it's kind of like secondary trauma. Someone else was dealing with this, but it had an emotional impact on me. And now I'm kind of carrying this. Obviously, working with DCF involved families, there's a lot of that vicarious trauma there. So I think that's where most of my training has come from, as well as like just like being in a clinical counseling education program.
That's so exciting to hear and very inspiring. Do you have a best practice that you currently do to manage your vicarious trauma or that you did do before?
Well, for me, I think the biggest part, and this is something I would like probably give advice to anyone, is that number one, you have to know what vicarious trauma is. A lot of times people might get it confused with like staff burnout. You might get it confused with compassion fatigue, but they're so totally different things. So
Mhm.
once you realize what vicarious trauma is, you also have to have that self-awareness and know how it's impacting you.
Right.
So there are times where I might have different symptoms, right? There might be, maybe I have tension headaches. There might be times where I might feel a little bit withdrawn. So it's all about really knowing how your vicarious trauma is really impacting. What is your body telling you in that moment, and kind of what you need. So it all depends on what I'm feeling in that moment, right? So I'm a person that I love movement. Going on walks is one of my things I love to do. I love to try a new recipe. I love music. So I love to create a new playlist just to kind of get things going. But again, it all depends on where my vicarious trauma is happening in my body at that moment, right? If it's a
Right.
tension headache, maybe movement is not for me, and maybe I just need to be in silence for a little bit, and it's
Mhm.
okay.
Do you feel like you have a good structure of people around you that understand what you do for a living and what you would need? And how important was that for you as you go in the professions to say, I really need people to understand what I do for a living?
100%. So I would definitely say I have a strong bond with colleagues who obviously we're all doing the same work. I think that's always going to be a good, important protective factor. Sometimes you just need to vent, and sometimes they're going to kind of help you through that situation.
Mhm.
As far as like my personal life, I have a lot of people who just know can at least empathize with what I'm going through, even if they've never worked in this field, but can empathize the things that I'm dealing with and can kind of just be there, maybe just asking, what do you need from me in that moment?
Yeah, what I like talking to people about is how important that your support network not try to one up each other, right?
Right.
Yeah. And the other thing too is that I say it's cool that you have coworkers that understand what you do for a living, but you need to be careful not to trauma share and trauma vent. And when you go out, that you're actually out and not talking about work cases when you're doing self-care, right? So
Yeah.
those are some other tips. But um, what is your go-to if you had to read a book about this, or if you had to tell someone the one thing you have to do is what to manage your vicarious trauma?
I'm going to always go back to self-awareness, be much more aware of how this is impacting you, right? It can impact you mentally, emotionally, behaviorally, how are you acting? So I think that's the biggest part before you can kind of figure out what strategy is actually going to be helpful for you. I can sit here and say, do deep breathing and do mindfulness. Me personally, deep breathing doesn't help for me,
Yeah,
right?
yeah.
So it's all about finding what works for you. But
Yeah.
once you know how your body responds to vicarious trauma and what it's telling you, then you can kind of figure out how can I put this at ease. A lot of times, working as a school counselor, we take on so much, right? We're just kind of that trauma dumping comes to us, and we're just kind of expected to just stay, emotionally regulated and just continue the day, right? I deal with students with crisis interventions, and then 2 minutes later, I'm on to the next student, right? There's no time for me to decompress. So this is why it's so important to know, am I getting to that point where I need to take a minute and take a step back, or what else is necessary for me?
Yeah. It's interesting how many people conflate managing vicarious trauma, which to me is a byproduct of the job, and self-care, which is a component outside of work, and both are needed, right?
Yeah.
Is there something that you do for your self-care these days that's resonating for you?
Definitely walks. I love to be outside. I love to go for walks. I have a beautiful, well-trained dog, so I love to take her with me. And I know it's good for my physical health, but it's also good for my mental health.
Yeah, that's great advice. I have every episode leave with one bit of advice, a quote, a mantra to spill the beans. You have 2 decades of a career. And I would assume that your vicarious trauma resonates differently within your evolution, right? With the different hats that you wear at different organizations. But what's one thing that would be your staple go to spill the beans with us today?
I would say self-care without systemic support has many limits.
Mm,
And I think that reaches to a lot of my work experience, not only currently, but former. But when you don't have systemic supports in place to help you, your self care is only going to get you so far. You kind of go into that survival mode, and we kind of need to stay away from that. Let's not normalize being a survivor, right? All should be together and should all be able to support each other.
right. Thank you so much, Candice.
You're welcome.
That leaves us for today. Thank you so much, everyone. Hi, everyone. That was a really great session for me, filled my cup. I have known Candice since college years, and it's been amazing to watch her and support her in her career, whether she's working with DCF, a nonprofit in the school system. She is someone that not only is she really knowledgeable around my research area, but she's so down to earth, and people really find her to be refreshing to talk to. And I also really enjoyed hearing her voice today. She shared that self care is not sustainable without systemic support. And I couldn't agree more. What I was reflecting on was the difference between self-care and group care. And so many people that I do workshops for or that I talk to do not understand the difference between self-care and group care. So I just want to lay that out. Group care is the idea of this systemic support. When your supervisor schedules a meeting during your lunch hour, or organizations don't provide professional development, that is group care. Self-care is you deciding that during your lunch break, you're going to go get your oil change and pick up lunch, or you're going to the gym and you're running errands, or you're staying in your office, you're going to meditate, you're going to read a book. Whatever you want to do for your self-care is your responsibility, and group care is the organization's responsibility. So, speaking true to what Candice is teaching us, she's saying that self-care is not sustainable without that protective factors, the systemic support around it. And we don't want to just survive work, we want to thrive within work. And that's what she's echoing to us. All great information from someone who's doing the work, who's studied and researched herself, and can provide us an additional component and perspective. So I hope that today's episode was exactly what you needed to hear in the moment that you needed to hear it. Thanks.